Hi everyone, I'm Caitlin Cobalt. I chose Catherine Kolcaba's theory of comfort for application in cath lab. I believe this middle-range theory fits well in cath lab setting where patients face both physical and emotional stress during not only interventional procedures but diagnostic procedures as well. So Catherine Kolcaba's theory of comfort is a middle-range theory. It's focused on physical, psychospiritual, environmental, and social cultural comfort. Below, I also included the conceptual framework for this comfort theory. So the first to touch on the meta paradigms is person. So in Kolcaba's theory, the person is seen as an individual with physical, psychospiritual, social, culture, and environmental needs. So in the cath lab, what this means is we're seeing the patient as a whole. We're not just seeing the patient as it's just a case that we're doing and we're just there to provide an intervention. It's not about that at all. We need to consider the patient as stated as a whole, as well as be concerned about all their existing conditions as well. And these patients may have anxiety from their existing conditions or worried about the outcomes. Next is environment. The environment in the cath lab can be very scary, especially if a patient has never been in the cath lab. Usually when they enter the cath lab, it's because of an emergency situation. And it's very bright in the cath lab. It's very cold because our equipment needs to be cold to be able to function, such as the x-ray machine. And there's a lot of alarms, especially if a patient is not stable. The defibrillator is always going off. So this, of course, produces a lot of stress on the patient, and it's important for the nurses to reduce these environmental stressors by adjusting temperatures or, reassuring the patient of why there are noises in the cath lab. Health. So Kolcaba defines health as optimal functioning as perceived by the patient. So in cath lab, improving patient comfort, whether that means managing their pain or their anxiety, can overall contribute to how the procedure flows, as well as it helps with a faster recovery and overall satisfaction of care. The last one, nursing. So nursing in this theory is about assessing patient comfort needs, as well as intervening if need be, and then evaluating. So in the cath lab, this might involve patient teaching, post-op, and intra-op, as well as positioning your comfort, and just, of course, just reassuring the patient throughout the case. So why does Kolcaba's theory fit well with cath lab? So patients often endure, high anxiety, pain, and discomfort during the cath lab. And as stated before, a lot of these patients come in emergency situations. They've never been in here, and there's a lot going on. There's a lot of people in the room. So comfort improves patient safety and their overall experience. Not only are these patients already having potential chest pain, shortness of breath, or like I said, just anxiety, by using comfort-focused interventions, we can promote relaxation, reduce that stress, and then, of course, as stated, just have an overall positive experience for the patient. So, an example of something we can do is anxiety reduction for the patient. As stated, pre-procedure, intra-procedure, and honestly sometimes post-procedure teaching as well helps reduce anxiety, as well as guided breathing. Just, explaining things to the patient helps them. They don't know what's going on. They can't see anything, so it's us nurses need to sit there and explain everything to the patient, and sometimes it really does help the anxiety. And when we lower patients' anxieties and we reduce their fears, it lowers their heart rate, respiratory rate, and their blood pressure, which then, of course, makes the procedure safer. Example 2, pain and positioning. Those beds in the cath lab are very hard. There's not a cushion to them. It's almost like a table. A lot of patients complain of back pain. So our main thing is padding, repositioning the patient as best as we can, especially while they have sheaths in place. It's very hard, but it is doable. And then it being cold in the room for the equipment, warm blankets are a patient's best friend. So, of course, improving comfort then improves cooperation with the patient. So in summary, Kolcaba's comfort theory addresses all four of the meta paradigms of nursing. It's a strong framework for patient-centered care in the cath lab. and it overall improves patient safety, care, and comfort. So by focusing on comfort in physical, environmental, and psychosocial, spiritual areas, we can improve both patient experiences and the outcomes. So thank you for listening. That is it.